Good afternoon, everyone. My name is Matt Sharp. I'm the Chief Executive of Goulburn Valley Health. Before we go any further, I'd like to acknowledge the traditional custodians of the land on which we are all gathered, pay my respects to elders past, present and emerging, and any First Nations people with us today and any people with First Nations connections. Thanks for taking some time out this afternoon to hear about what's happening in relation to the COVID outbreak in Shepparton. We've got a really helpful forum, I think, that's planned for the next hour or so. We're happy to spend the full hour with everybody online today. The format will be in a few minutes. I'll just provide a short overview and update about where things are placed in relation to the outbreak in Shepparton. We've got Professor Paul Johnson, who's the Medical Director and Lead for the North East Melbourne Public Health Unit. Paul was with us for our previous forums a month or two ago, and Paul's going to provide us some information and updates about how we're managing outbreaks at the moment. Kay Thompson, Director of Community at City of Greater Shepparton, will talk with us about relief arrangements and how people can access support they may need while they're isolating at home. And then Sharon Hengsman-Smith is from the Department of Education and Training to share some information about schools and updates in that sense. We've also got a panel behind the scenes. Of course, at the moment, you can only see myself and Lisa, one of our wonderful Auslan interpreters. But we have Chris Hazelman from the Shepparton and District Ethnic Council and Felicia Dean, who's the CEO of Rumballara Aboriginal Corporation, in our panel, also with Hugh Varley from the Department of Health. So behind the scenes, there's a small team of us doing some work to bring you, hopefully, the information and answer the questions that are foremost on your minds. So with that in mind, so as I said, the information we want to share with you, I think, should take us no longer than half an hour, and then we'll have plenty of time for questions and answers. In relation to the question and answers, please pop that into the comments section on the Facebook page, and then I'll be able to collate and respond to those questions later on during that session. So again, thanks to Lisa and Linda, who are helping us today from an Auslan interpreter perspective, and they'll be interchanging throughout the session this afternoon. I'd just like to say one or two things in relation to where we are placed as a community at the moment. Of course, the lockdown came about fairly suddenly in terms of the announcement on Friday evening that it would be effective from midnight on Friday night for a week. To some of us, I guess it was a surprise. To some of us, perhaps not, in terms of the escalation of the case numbers that we had seen towards the end of last week, and certainly what we've seen in the last few days. One thing I'm really confident about in terms of the Shepparton, Mooroopna and Greater Shepparton area is that we are a strong and, I would say, in some ways quite a tough community when the chips are down, as they have been a few times in the last 6 to 12 months. Everybody's come together and played their own important role, no matter how big or small, to support the community when the time of need's been its greatest, which has certainly been the case in these outbreaks. So I'm really confident that all of the different agencies and services will continue to come together and work hard to provide the support we need to help those people who have COVID and to keep our essential services operating, not only at GV Health, but more broadly across the community. I know this outbreak's been a little bit more of a challenge, certainly for me even, and I'm conscious that if I'm feeling that way, I'm sure that many other people are perhaps feeling a little bit down or perhaps a bit worse. And that's probably normal. I mean, it's been a really tough 18 months. And from that perspective, I'd certainly encourage anybody who is in need of additional support to seek that out through friends or family members. Don't be afraid to ask anyone for help. There's some terrific resources on the Department of Health's website, coronavirus.vic.gov.au, and also the Beyond Blue website. the hardest thing sometimes when you're asking for help is to do just that, just to take that first step. So if you do feel like you need some support, reach out through any of those ways. Pick up the phone or look online where you can access information. In terms of the outbreak at the moment, as you've probably heard, I'm not going to spend too much time on this today. We're at 53 active cases at the minute. There's been 11 new cases in the last 24 hours. There's plenty of access to testing facilities, both at the GV Health sites here at Graham Street, but also at the Shepparton Showgrounds. There's GP clinics that are providing testing, say, for example, Princess Park and others. And the coronavirus website has all of the information where you can access testing from. Just in relation to testing, as I've said a few times, as soon as you get symptoms of COVID, it's really important that you go and get tested straight away. Please don't put it off for an hour or two, or even, half a day, 1 or 2 days. We are unfortunately seeing examples where people are doing that, and then that makes it a lot more difficult for the contact tracing team to contain the spread and get people into isolation. And that's been our mandate right throughout this pandemic. And in fact, I think Paul Johnson coined the phrase is to go as hard and fast as we can to contain the spread of COVID. So that's something that we can all do. As soon as you get symptoms, get tested. And then on the back of that, another really important thing to do is to get vaccinated. So at the moment in the Greater Shepparton local government area, we have, these are today's figures, 89% of the residents have had a first dose of a COVID vaccine, and 52% have double dose now. So there's still around 6,000 people that haven't been vaccinated. And of course, we're really keen to have those remaining 6,000 people vaccinated as quickly as possible. So please, if you haven't made an appointment, either at one of the GV Health sites or at a GP clinic or a pharmacy, please book in as quickly as you can to be vaccinated. We know that that's the best way to stop you and your loved ones from getting COVID, and it's the small and simple thing that we can do in that regards to stop the spread of COVID in the community and protect your loved ones and other people that you come in contact with through work or other pursuits. So I might pause there and I'll introduce Professor Paul Johnson once again. So we'll go through our guest speakers now and then come back for question and answer. So we'll go through to Paul, then to Kay, and then to Sharon. So over to you, Paul. Thank you.
Thanks, Matt, for the introduction, and thanks for taking the time to listen today. I'll just say a few sort of general words, I think. There was a time when we were aiming for zero COVID or elimination of COVID. And during that period, a lot of very fine detail was introduced to control cases, their contacts, and even the contacts of contacts called secondary close contacts. There was a lot of regulation and a lot of careful, long 4 to 5 hour interviews to try to work out where people had acquired COVID and where they might have transmitted it before they were isolated, which included things like finding about every shopping centre they'd been to and every place they'd been. And we found when we were working in the northern suburbs of Melbourne, that pretty much everybody who lives in the northern suburbs goes to the Craigieburn central shopping area. So after a while, that started to confuse us. Now, things have changed hugely since the days of zero or the days of near zero. And when Matt was speaking, I was thinking, well, having 52 cases in Shepparton today sounds a lot, and it is for Shepparton. As you know, I worked up there a few weeks ago and we were pushing back down towards zero then. But in the Nephu area, which is the northeastern part of Melbourne, we have 1.6 million people in our zone, and we're having hundreds of cases, like 300 or 400, 500, 600 cases, new cases a day. And clearly all of that bespoke, careful, systematic, finding out where people got it from and where they might have transmitted it to it's just not possible anymore under these circumstances. And the other thing is it's clear that we're not now going to control Delta. So what we're trying to do is squash it, reduce it to take the impact off the hospitals while we catch up with vaccination. Now, the good news in all of this is that the vaccination effect is really holding up, so that the benefit of vaccination is such that in the United States at the moment, if you've had 2 vaccines, you're 11 times less likely to die of Delta strain than if you haven't had any. So, and that we're seeing that in Melbourne as well. Unfortunately, we have significant numbers of people in our intensive care units, and they're almost all not vaccinated, or if they are vaccinated, they've had 1 dose. Now, there is a paradoxical thing that will develop much later, which is when the vaccination is becoming almost universal, there will still be people who have the 2 vaccines who end up in intensive care. So that will confuse people, but hang on to the fact that it's the best thing you can do, and that it really, really makes the difference between COVID being a nuisance and COVID being a killer. So look, one thing's apart from death and taxes that is certain is that we will all meet COVID this year, Delta COVID, probably by Christmas, because once we're opened up and we're definitely on that path, there's no avoiding it. So the only real choices we have are to face it alone and hope that we can deal with it, which 95% of us probably can, or face it with an augmented immune system courtesy of 2 doses of the vaccine, which makes an absolutely massive difference. But the idea that you can both avoid vaccination and avoid Delta is an illusion. You're going to have to deal with both of those. And that really is the pivot now, that this was once a very special thing that the Department of Health was really interested in and managed it, really close to, really closely. But it's now the citizens virus. This belongs to all of us. We've had 18 months to learn about it. We were all experts in it, and it's now so big that certainly in Metro Melbourne, we can no longer deal with it except at the kind of mass population level. So there are now big changes happening in the way COVID is managed from the official point of view, which definitely applies in the metro zone, but may or may not apply in the regional zones, depending on what your regional zone is trying to achieve. So if you're a very small town with a very limited outbreak, you may well want to go back down to 0, because let's face it, life with 0 is a whole lot better than any other type of life. But so the changes that are being organised centrally are not compulsory changes, but they kind of create a new, the philosophy is self-reliance and automation are the 2 things. So that it's people and businesses look after yourselves will be how we develop this. It's not got there yet, but that's where we're going. So in other words, you get a message to go and look on this website and do the following things, and get vaccinated. So that's it. And then with respect to getting tested, as Matt said, it's very important to get a test if you have any symptoms. And initially we were saying that because you can protect the rest of the community from further transmission, which is still important because it reduces the impact on our healthcare system. The less COVID we have around while we're all getting vaccinated, the better. But the second important thing is there are now several things we can do to make your life better, even if you have COVID. So we've got a new drug we can give you if we detect you early, which is effective if it's given early. We can, if you do get into hospital, we can give you oxygen, we can give you steroids, we can give you a drug called remdesivir. And if you do need to go to intensive care, Australian intensive care has one of the best outcomes, or has the best outcome in the world for COVID. So if you do have COVID, you don't want to miss out on those things. You don't want to be one of the people who dies at home not realizing that you're sick. So not getting tested is a personal own goal as well as a societal own goal. So get tested if you think you've got symptoms, because we can help you as well as help others if you're positive. So just run through the changes that are coming up. So this is already enacted down in Melbourne. And the first most important one is that we're no longer interested in close contacts defined as tier 2 close contacts if you just happen to be passing through an area. So a good example of that would be some infected staff at a supermarket, maybe 4 or 5 staff who would be working together and having breaks together. They would all still be classified as tier 1. and we used to then get all of the DVR data, which means the QR code data, and send messages to all of the people who've been in the shopping centre, who maybe for several days, which could be hundreds of people. And then that site will be listed on the website, and then people sometimes would self-identify even if we hadn't contacted them. So this is now not done anymore. It's still an option you may want to consider in Shepparton because of where you are in your outbreak. But down in Melbourne, it's now so common to be called up on one of these QR code recalls that you can really think of Melbourne as one great big tier 2 site. And to prevent everyone always being on their way to getting a test and then isolating until they get a result, we've decided to, the decision's been taken at a high level to remove that anymore. So places going up on websites and QR code texting for people who are tier 2 is now a thing of the past. And the other saving from that, apart from the complexity of having so many people out of, on their way to test and staying at home until they get their result, is the pressure now on the testing system. So testing is now taking a whole lot longer, which means we are getting delays in really critical areas. So what we're trying to do is unload the contact tracing system with low yield return, things such as tier 2 exposure sites, and to clear out unnecessary burden in low yield examples on the testing so that we can keep it for the really important areas and keep that turnaround up around 24 hours where it's been most of the year. We're also not creating SCCs anymore. So if you were a contact of a primary close contact, which you may recall from the school exposures, you had to stay home as well. But that's no longer being done in Melbourne. What else have we got here on the list? So we also now are clearing primary close contact automatically the moment they get their negative test result for their day 13 test. So that would mean that if you're in quarantine as a primary close contact, you come up for your day 13 test, you get your negative test result on your phone. That's it. There won't be any further communication, and that's enough to clear you. So that's a big change, also semi or significantly automating and reducing handling. And a lot of people are very pleased about that because that was causing quite a lot of delay, that you got your test and you're waiting and waiting and waiting to get a call from your LPHU. So that's over as well. So we've got automatic clearance of primary close contacts. We're not collecting social close contacts anymore. We've dropped the tier 2 and exposure site listing and the tier 2 classification at exposure sites. And we've also got something else called rolling quarantine, which I can talk about if you would like to, which will also be significantly altered. So I might leave it there and just see what questions that presentation elicits. Thanks very much.
Thank you, Paul. I'll hand over to Kay Thompson, who's a Director of Community Services at Greater Shepparton City Council, for some information about relief and support arrangements. Thanks, Kay.
Thanks, Matt, and hello everybody, and thank you very much for tuning in, because the more information we can get out there, the better. So let's see what information I can provide regarding relief, and then if there's any questions, we'll try and answer those as well. So just quickly, Council has 2 roles in emergency management. The first one is to assist with resources. So we're doing that in this pandemic with providing some buildings and providing some staff to help through the pandemic process. Our second most important role is relief and recovery. So we have a major role in relief, and we do that with partners. We certainly don't do that by ourselves. So if there's one thing you need to remember tonight, it is the 1-800 number to get through to the relief support number. So 1-800-675-398. 1-800-675-398. That number takes you through to a Melbourne call centre, but it does triage what your issues are. So the team down there listen to you, understand what your needs are. If you're in isolation, that means they can assist you with 14 days worth of food that will be sent through from Red Cross. Red Cross do that in a contactless way. They ship the 14 days worth of food and another box full of toiletries straight to your door. So it's a contactless process, no need for volunteers putting themselves at risk. And that process works through the 1-800 number. Now, when the team speak to you, and if you raise particular issues, so if you have a more complex case, if you are requiring Panadol or nappies or baby food, they can actually then contact us at council, and our case management team take that case on. So our case management team will then contact you and talk to you about what your particular needs are, and then deliver those particular needs to you. As I said, we don't do this on our own. We have some great partners, and we met with our partners this morning. So we had an 8 o'clock meeting with Red Cross, the local team, Salvation Army, the Point of Difference, Food Share, Lighthouse Foundation, which is GV Cares, Greater Shepparton Foundation, the Ethnic Council, Uniting Services, Primary Care Connect, and Rumballara. So all of those agencies are ramping up and ready to go if they are required in this outbreak. So Food Share have a couple of 100 packs ready. They have 150 halal packs ready. So triaging that process is now our job. We know that the 1-800 number sometimes can be a little bit slow, but it is the only way that the state can understand exactly what our need is. So we really want you to use the 1-800 number first. If for some reason the 1-800 number confuses you and you find that you're just not sure how to work the system, the council customer service number is your next number to ring. So 58329700. So the contact number at council will also speak to our case management team, and then our case management team will get in touch with you. So there are those two numbers and those two ways to get contact. I suppose the other issues that we need to speak about is that if you ring the 1-800 number and you need an interpreter, start by pushing 0. As soon as you get through to the 1-800 number, push 0, and then someone will help you with an interpreter. If you're looking for food assistance, you push 4 and then you push 4 again to get yourself through the process of the 1-800 number. As I said, our partners that we're working with are all prepared and ready to go. So please don't be afraid to ring the 1-800 number. And as I said, if you feel uncomfortable about that or it's not working, ring the council customer service number. The other little document that I want to encourage you all to look at is our support brochure. We have a support brochure that is sitting on our council website that talks about other services that are out there that might help you. The brochure is called Looking After Yourself and Others, and we're popping it up on council's website as we speak so that people can get access to it and use the numbers within it. We understand that relief is not just about food. Relief is about other services. People are hurting. Matt talked about it. We're all tired. We're all feeling quite vulnerable as we tackle these surges and these new outbreaks. So in that little brochure, there's lots of contact numbers that may help you. One of my favorites is the Primary Care Connect Click and Connect service. So they have a service where you can ring them and just say, I just feel lonely. And if someone can ring me on a daily basis, that would be great. So the Click and Connect service is 58233200 at Primary Care Connect. The other one that is could be really helpful, particularly with our young people, and we understand that young people are really getting sick of this process and sick of being told that they need to be in lockdown and need to isolate. There is an e-Headspace number, which is a 24-hour service for 12 to 25-year-olds. So it's 1-800-650-890. But all of these numbers are in our little brochure. So if you can't remember all of those, please just go onto our council website or our council Facebook and these little brochures will pop up and you'll be able to download them or just look at them and see if you can find a support service that helps you. In Greater Shepparton, we have a lot of great support services. There are people here that want to help you, and we just need to get in contact with them. So the final message from Council is we are here to help. Start with the 1-800 number. If that doesn't work for you and it confuses you, please ring our customer service number on 58 329 700. I think that'll do, Matt, and I'll happy to answer any questions later.
Thank you, Kay. Much appreciated. I'll now hand to Sharon Hangsgen-Smith from the Department of Education and Training just to talk about where things are placed in relation to schools and any further information and updates about schools in the coming weeks or two. Thanks, Sharon.
Good afternoon, everybody, and thanks, Matt and the team, for the opportunity to contribute to this community forum. Firstly, I'd just really like to say a big thank you to our families and community services for how we've been able to work together to support our children and young people to engage with schools, whether that be on-site or whether that be through remote and flexible. So this week, what does schooling look like? So on the advice of the Department of Health, we have moved to remote and flexible learning provided from today. For students in years foundation to year 11, to year 12 today. Tomorrow, our VCE students, our year 12 students, will come on site to do the general achievement test, and your school will have provided you with an understanding of the arrangements around coming on site to sit that test. And then from Wednesday, the 6th of October, our VCE Year 12 and final year VCAL students will return to on-site learning. And of course, as always, we are providing on-site supervision for vulnerable students and children of essential workers. So that's this week. Next week, all being well and that we're out of lockdown, we'll commence the roadmap for return to school that was announced last week. So what does that look like? Well, from Monday, the 11th of October, we'll have preps, grade 1s, grade 2s, year 7s and year 11s return to on-site learning for 5 days a week. On Tuesday, the 12th of October, our years 3s, 4s, 8s and 9s will return to on-site learning on Tuesdays and Wednesdays. And then on Thursday, the 14th of October, our years 5, 6 and year 10s return to on-site learning on Thursdays and Fridays. And these arrangements that I've just described then will continue for 2 weeks. We understand that this staggered start will be challenging and could be confusing, but what it does do is provide an opportunity for our students in Goulburn and across the state to re-engage with on-site learning sooner rather than later. And then again, all being well with our COVID environment, we hope to have all students returning to on-site full-time learning. And that again is from Tuesday, the 26th of October. But of course, the arrangements for this week, things happening next week is all dependent on what our COVID environment does look like. And as always, we respond to the advice provided to us from the Department of Health. But your school will be best placed to provide you with information around what schooling looks like for your young person. So can I encourage you to maintain contact with your school, as your principal and school leadership will be communicating with you, as well as your classroom teachers as they provide remote and flexible learning this week. So health and wellbeing support is available to all students, whether we are in remote and flexible or on site. So again, please discuss your needs, your family needs, or your young person's need with your teacher or your learning mentor, and they can link you in with school supports, with area supports, and the supports that Kay Thompson has just described to us that are available through our community support agencies. So when we're back on site, COVID safe behaviours such as mask wearing, social distancing, hygiene measures and room ventilation will be really important. So thanks everybody for your support in complying with our requests and contributing to keeping us all safe. Finally, I'd just like to say that we're really proud of our schools and early childhood services for their dedication to their communities and the support that they're providing through these really challenging times. And thank you for the way that you've been able to continually engage with us and respond to the advice that we've been provided and the teaching and learning that we've been able to provide during this time. Whilst COVID is with us and as we return to on-site, it'll be really important that we continue to work together to respond to positive cases and keep our school environments really safe. And like others, I'm very happy to answer any questions once we get to question time. Thanks, Matt.
Good, terrific. Thank you, Sharon. Thank you, Linda and Lisa. So we've got plenty of time for questions. In fact, we finished right on time. How about that? So we've got at least 30 minutes to go for questions and answers. So I've tried to keep an eye on the questions as they've come in. So, and if you see me looking down, I'm monitoring the comments in Facebook in terms of the questions and the chat function. So that's what I'm looking at. Katie, if we could do a couple of things with our Facebook page, if we could just repost the information in there about the opening hours and the links for the testing sites for everybody to see. And also there's been a number of queries about the phone numbers to access relief and support. If we could just post them in one collective post either during this session or as soon as we finish. Just going through, there was a question, Sharon, sorry, about do VCAL students sit the GAT? It's been a while since I've been involved in VCE or year 11 and 12 level subjects. So could you answer that question,
No,
please?
they don't.
They don't? Terrific. Now, it looks like we've got a couple of other things, Paul, for us to work through here in terms of, I can just give a brief answer to the age of cases. So in relation to the outbreak that we have at the moment compared to August and September, what we're seeing is far less children, both preschool and school-age children, testing positive. A lot of the cases that we're seeing at the moment are people in their 20s, 30s, 40s, and then right through to 60s and 70s. It's got a slightly different age profile, but there are a smaller number of teenagers that have tested positive, but not as significant as 6 weeks or so ago. Paul, could you, in no particular order, could you just answer a question about the vaccine options for people aged over 60 years? That did come up earlier.
Okay, so it's now whatever you can get. So you can now get Pfizer, you can get Moderna from your chemist, and you can get AstraZeneca anytime you want for the over 60s. It's just a matter of what you can access. I think the best slogan I've heard for a long time is the best vaccine is the one that's in your arm. And that, you know, maybe was true last year when we had 0, but it's absolutely true now. So what I said earlier is, you know, it's just so obvious down in Melbourne that we're all going to meet COVID Delta. It's just going to happen to us by Christmas, because we'll be opening up in November and we have to all be protected somehow or other. So I think if you're quite happy to have AstraZeneca and you're over 60, go and have it. If you're concerned about it, go and have a Pfizer. And if you can get access to Moderna in your chemist, go and get that. And then I think it's pretty likely that next year or even late this year, those of us older people or people with risk factors, and then everyone will get be required or be recommended to have a booster. But we're not going to go to boosters yet until everyone's been around the circuit once.
Yep. And just some information for the community. We do now have access to the Moderna vaccine. So as of this Wednesday, people can walk in for an appointment for Moderna vaccine at the Macintosh Centre, or you can book by calling 1-800-675-398. That's the same number Kay mentioned before, or book online at coronavirus.vic.gov.au. But Paul, are you able just to talk briefly about Moderna and how it works relative to, say, the Pfizer vaccine?
So really, Pfizer and Moderna are a bit like a Falcon and a Holden in the days we used to manufacture them. They look slightly different, but they're really the same package. So they're both mRNA vaccines. They've both got the same risk and safety profile, and they work very, very similarly. So I don't think there's much to choose between them. There may be some slight advantage of Moderna, but it's not worth using that to make a decision. It's much better to get yourself vaccinated. Remember that if you start now, you still have to wait between the doses, and the doses have been brought forward closer together. And then you've still got to wait up to 2 weeks after the second dose before you're fully protected. So the name of the game now is to get yourself protected because of the coming storm, really.
And eligibility for Moderna, do you know?
I don't think there's any restriction on it, but I might be wrong. But it's delivered through pharmacists. I think it's right down to quite young age, and I don't think it's got an upper limit of age, but I'm not the total expert on that. I'd be happy to be corrected.
Yeah, and just to, we were, so sorry, I've just found a note that someone had provided to me. So it's available for people aged 12 to 59 years of age, and we've managed to get a supply of some doses, 6,000 doses coming out of Melbourne this week that'll be here at our vaccine hub at Macintosh Centre. So again, you can walk up on Wednesday, or we're going to run an extra session on Sunday. But we encourage people to book at by calling 1-800-675-398 or coronavirus.pic.gov.au. The other question, so people that are aged over 60, I think we clarified that one a few minutes ago. The other question is, which is the $64 question, I think, is when are we going to get out of lockdown? Happy for you to have a shot at that one, Paul, if you like.
Well, look, just by the way, there's an update in the chat which says Victorian pharmacists are now also offering the Moderna vaccine, which is safe and effective mRNA vaccine. As I said, it's identical really to Pfizer. This vaccine also on offer at select state sites for anyone aged 12 to 59, as you said. GPs and pharmacies are now providing both Pfizer and Moderna to all ages, including those above age 59. So it's really just get yourself vaccinated and get it done quickly, whichever way you can. So with respect to, you want me to just pause there and see if there's any questions about that, or go on and try and answer the lockdown question?
Yeah, I think the lockdown one's the $64 question. Yeah.
Well, the roadmap is to start easing during October, I think around the 3rd week of October, and then to progressively open up during November. So that's what I heard recently that's the kind of Victorian government thinking. Will they modify that according to how things are going? Well, I don't know, but I think now it's not the time now. I think my personal advice to them, if they ask me, which they don't, would be to, particularly once we get to November, just to keep going and progressively open up. They'll probably try to do it in stages so that they can see the effect on the hospital demand. But I think the overall feeling is that during November and December, we'll be living with COVID and relying on vaccination with something like maybe universal mask wearing and maybe some limitations on the size of indoor gathering. So masks are still very important at a population level as a way of, if we're all wearing them, reducing transmission rate, which, so it may be that we're left with masks for quite some time. We'll also be doing contact tracing, but nowhere near the same detail. It'll be trying to control significant outbreaks at special places, e.g. homeless people's shelters, intellectually impaired people's living areas, prisons, immunocompromised groups, so that we'll be trying to focus on the people most likely to have high impact from being infected and trust vaccination to protect the rest of us.
Yeah. Thanks, Paul. There was another question. So Moderna is available, as I said before, and Helen Roberts is online, who's our medical director for the vaccination program, and Helen's confirmed that it is available for people aged 12 years and above, up to 59 years is my understanding. So any school-aged children, of course, 12 years and above, who need to be vaccinated before going back to school, that's as I said before, 6,000 doses we'll have from this Wednesday, but you can also book at pharmacies and GP clinics, beg pardon. The other couple of things, Paul, for you is just some commentary. It's a bit hard, but there was a question earlier about infectious, from when someone's exposed, when are they generally considered to be infectious from? And it's a bit around the test results. So maybe if you could just talk through how that process works as well, please.
Okay, so if you develop symptoms today, which is Monday, then we epidemiologically regard you as infectious on Saturday and Sunday. So even though you didn't know you had it, you develop symptoms on a Monday, we do a test on a Monday, and we get the positive result on Tuesday. Then we, from a contact tracing point of view, say you were infectious on Saturday, Sunday, and Monday, which is the day you decided getting symptoms, and hopefully you went into isolation as soon as you realized you needed a test. So you are then regarded as, from a legal point of view, as under a direction, because you now have COVID and you must isolate for a set amount of time, which is 14 days. So that would be, if you got the symptoms on Monday, day one would be Tuesday, and on the 14th day, you are released. Now we're going to, certainly down in Melbourne and probably everywhere, just release you on a date system. So you're released by the date that's entered into the system, and you don't get any further letter or anything like that. You may get a text to tell you you're released, but that's all. That's part of the automation process. We won't be giving you a phone call. We won't be taking into account symptoms. We'll just release you from your public health control order based on the number of days since you first developed symptoms. If you never had any symptoms, but your test was done on Monday, then it's 14 days after that. So we use 14 days. But if you had symptoms for 5 days and you have a positive test, then we go back to the beginning and take that off the 14 days.
Thank you. And there still continues to be some commentary in the chat feed about tier 1 and tier 2. I just want to assure people we're just changing our focus is the best way to think about how we're managing tier 1 and tier 2 exposure sites. So what is clearly the case, and as Paul mentioned before, there's increasingly a lot of exposure sites that come about, particularly the tier 2 sites and tier 3 sites, very quickly. And what we are now relying on, to use that phrase that Paul mentioned before, that COVID, and certainly the Delta strain, is a citizen's virus now. And what we are actually doing is working with the community through the tier 2 sites to actually share information about certain exposure sites, or where people have been through their workplace or other means, for example, or different venues, to share that information and quickly have people come forward for testing. I acknowledge it is a different approach to how we've run tier 2 sites previously, but what we're finding is that it's a really quick and effective way for the message to be spread. People are generally a lot more aware and comfortable and know what to expect at the moment in relation to COVID. But importantly, the second thing that's really critical for us is that then frees up our contact tracing team to do the really important work in focusing on high-risk tier 1 sites and high-risk households where we know we've got some complex and challenging issues to work through. So it's a way of changing things in a slightly different fashion to what we have done in the past, but it's primarily comes back to that, what I mentioned at the beginning of this session, is we are still focused on going as hard and as fast as we can to contain the spread of COVID. And that's one way that we know is proving to be effective, hence Paul explaining what's been occurring in Melbourne.
The other thing to say, Matt, about the tier 2, for example, all of those shopping centres and all of those supermarkets we listed, we found very rarely that it was actually transmitted by people just walking past each other, even though it appeared to initially. But when on reflection, they also had contact with other people outside. So even though Delta is very transmissible, you're still much more likely to get it in your household or in your workplace, where you're having multiple contacts in a day with a case, as opposed to the one contact you might have had at the checkout. And then remembering the checkouts are all well designed now with the Perspex screens and the mask. So basically listing all of those places just wasn't getting us many cases either, but it was gumming up the system and gumming up the testing. So that's part of the reason. It's a rationalization approach. But just remember that, as I said, it is the citizen's virus, and that means you can take action yourself without having to wait, and you may wait in vain because it's just so busy that we may not get to you. And a good example recently is a small business down in Melbourne. I think it was an engineering business where they had 2 cases in their staff. They quarantined everybody, they got them all tested, they got all the day 13 results back, and then they rang us up and said, can we clear you? And we said, well, we never even knew you had a problem. And so they in fact did the entire thing exactly right, textbook, but never got on the system. And that sort of was, not, on the one hand, disappointing for them, but on the other hand, it was perfect from a public health point of view, because it doesn't require any paperwork on or off. The only problem with that is that you can't qualify for special payments from the government if you're not registered. And in this case, they had sick leave, so they didn't need to worry about that. But that thing of self-reliance, work it out yourself, seek guidance when you can, but if you can't get it, apply common sense and try and solve your own problems while you're waiting for the system to catch up.
Thanks, Paul. So one more question for Paul, and then I'll ask Felicia and Chris to make any comments about services specifically that their organisations are overseeing. So, Paul, the final question at this stage is any early thoughts around vaccinations for children aged 11 years and younger? Have you caught up with any of that?
Look, I think it's all a matter of trials and licensing. So the trials have been done overseas with Moderna, and therefore the TGA can look at that, look at safety and benefit. And so that's the answer to that question, is to watch the ATAGI website and see what you find out in the news. But I think, my children are adults now, but I'd be certainly happy to have them vaccinated with a safe vaccine that's been developed and approved properly, from quite an early age, because we know that they are going to be exposed to it. On the other hand, they're going to be exposed to it, and it doesn't look like the majority of them have any serious problems from it. So I think watch this space, and if they already qualify because they're 12, then go ahead and get them vaccinated without fear and with confidence you're doing the right thing.
Yeah, thank you. And Helen Roberts, I know I saw you pop a comment in the chat before. If you've got any other information as well about children aged 11 or younger and vaccination, please feel free to pop it into the chat function. So, Felicia, I'll hand to you just to discuss or provide an overview about services that Rumballara are providing for First Nations people. There was just there was a comment earlier on for yourself and Chris. So over to you. Thanks, Felicia.
Okay, thanks, Matt. So we're, like everywhere, we've got a fatigued workforce, particularly those staff that are working on the front line. However, we are working really hard to increase our workforce capacity. We currently have a point of care testing available. And our drive-through clinics reopen again tomorrow. We have vaccine clinics available, and we're trying to increase them to extend them out to 5 days a week. Bookings are required for to come into the vaccine clinic. We do have emergency relief available, and next week, fingers crossed, our mobile van that's being supported by the department and VATSHO will arrive and we hope to be up and mobile and reaching out to community across our catchment area to deliver vaccines. So that's really all the news I have, Matt, in terms of what we're doing at the moment. We certainly encourage everybody to come in and get a test. Particularly if you're feeling unwell, the quicker you do it, the better it is for us, and it's keeping everybody safe.
Thanks, Felicia. And Chris?
Yes, thanks, Matt. I think our starting point was that we believe there's a basic principle that someone's English language skills shouldn't prevent them having access to information that the rest of us would take for granted around whether it's about testing, vaccination or relief. So we've heavily focused on providing information into multicultural communities in first language. We've worked very closely with health and with public health to get this as accurate information as we can. We've had that translated into audio files, into first language. We've circulated that through communities using community leaders and the extensive communication channels that exist within communities to ensure that we get the right information there. And I think we're seeing the measure of that in terms of people that in the last outbreak of coming forward for testing. We're now heavily focusing on vaccination with the change in government approach. So we'll keep pushing those messages as strongly as we can. And we're working very hard with the public health people to try and target probably pockets within the communities that we think maybe have been hesitant to vaccination. We're awaiting data from health that will indicate what the vaccination data is based on communities, ethnic communities, and then we'll try and target those communities. We're very encouraged, though, that the figure that you quoted before of 89% would indicate that some of the reservations that people had that multicultural communities would be vaccine hesitant doesn't seem to be the case. We seem to be well above state average at this stage. So that's very positive, but we'll continue to provide the messaging that we can into these communities.
Thanks, Chris. So Helen did put a comment in the chat about 11-year-old and under age children getting vaccinated. That's still awaiting advice from the Australian Technical Advisory Group on immunisation. So that's still a work in progress. And as Paul said before, that's also the group that's providing advice about boosters or third dose for those people who have been double vaccinated already. In regards to Tatura, I think I've seen some comments in the chat about Tatura. There is one positive case in Tatura. I'm not aware of any more today. There could be some. I just haven't had a report or an update, but I don't believe there's any exposure sites in Tatura just yet. But we'll post any of those of concern. But again, as we said earlier, they'll be shared and amongst family, friend networks as well in the interim period. The other thing, I think we're almost there to the end of the questions, just monitoring the chat. Oh, there was one question about Jabba the Bus. Jabba the Bus is still out and about and active. Jabba's going not only around Shepparton, but around the whole parts of the Golden Valley area where our vaccination program is operating. So I think we're almost to the end of the questions. I might just see if there's any of the speakers or panel members who want to say anything, cover anything else off before we wrap up.
Matt, it's Sharon speaking.
Yes, Sharon, go for it.
If I could just provide some responses to some of the questions that I've seen come through. The return to on-site learning is very dependent on the advice that we receive from the Department of Health. At the moment, we are working to the metro roadmap settings, and we do very much hope that we come out of lockdown at the end of this week and can revert back to the rural return to school settings. But when we do get back on site, masks are going to be required for primary, secondary and teaching staff in schools for all the reasons that Matt and Paul have outlined. And the last thing I'd like to say is getting vaccinated is really important, and keep getting tested so that we know that when we have people on site that we can be as COVID safe and COVID free as possible. So we don't want to get back to the situation we had with schools where, you know, we had our student population, student to student transmission. So it's really important for us that we keep our environments as safe as possible whilst continuing to provide really strong teaching and learning through remote and flexible. Thanks, Matt.
Thanks, Sharon. And then still there's a couple more questions coming up about whether or not we'll be out of lockdown at the end of the week, and we really just have to wait and see what happens with the case numbers in the coming few days, and transmission and the like, and the deputy chief health officers and chief health officers will make that call towards the latter part of this week. I think we're almost there, unless any other of the members of the team can see any questions that we've missed. Okay. All right, so my thanks to Paul, Kay, Sharon, and also to Felicia and Chris as well, also to Linda and Lisa for interpreting. Well done. Nice to see you again. We'll wrap it up there, and thanks to all the comms teams and City of Greater Shepparton for providing the Zoom platform for us to run this forum. So thanks everyone, and all the best.